The fluorescent lights of Hospital General de Mexico hummed with their usual clinical intensity as Claudia Sheinbaum walked through the automatic doors at 11:47 p.m. She wore simple jeans, a plain white blouse, and comfortable walking shoes. Nothing that would immediately identify her as the President of Mexico. Her hair was pulled back in a practical ponytail, and she carried only a small purse. To any casual observer, she looked like another concerned family member arriving for a late-night hospital visit. But this wasn't a family emergency. This was an unscheduled inspection, the kind that revealed the true state of public institutions when they weren't expecting scrutiny. Sheinbaum had been receiving reports about understaffing, equipment shortages, and declining patient care at several public hospitals. Rather than rely on official reports that painted rosy pictures, she had decided to see for herself. The emergency department was busy, but not overwhelming for a Tuesday night. A few patients sat in the waiting area, an elderly man holding his arm, a young mother with a feverish child, a construction worker with a bandaged hand. The scene looked routine enough, but Scheinbaum's trained eye began cataloging details. The outdated blood pressure monitor, the torn vinyl on several chairs, the flickering light in the corner that nobody had bothered to fix. She approached the reception desk, where a tired-looking clerk was typing on an ancient computer. "Excuse me," Scheinbaum said politely. "I was hoping to speak with someone about the hospital's current needs and operations." The clerk barely looked up. "Visiting hours ended at 9, she said mechanically. "Family members only, and only for admitted patients. You'll need to come back tomorrow after 8 a.m. "I understand," Scheinbaum replied patiently, "but I'm not here as a visitor. I'm conducting an assessment of public hospital conditions. Could you direct me to the supervisor on duty?" The clerk finally looked up, taking in Scheinbaum's casual appearance with obvious skepticism. "Assessment? You don't look like you're from the health ministry. Do you have credentials?" Before Scheinbaum could respond, a sharp voice cut through the conversation. "What's going on here?" They turned to see Nurse Carmen Reyes striding toward them, her crisp white uniform and authoritative manner marking her as someone accustomed to being in charge. Carmen had worked at this hospital for 15 years, rising from a junior nurse to head of the night shift, through sheer competence and an unwillingness to tolerate nonsense from anyone. "This woman claims she's here to assess the hospital," the clerk explained, "but she has no identification, and it's well past visiting hours." Carmen looked Scheinbaum up and down, her expression growing more skeptical by the second. The woman before her looked ordinary, dressed casually, with no official documentation visible. In Carmen's experience, important people announced themselves with fanfare, arrived with entourages, and certainly didn't show up alone at midnight, dressed like they were going grocery shopping. "Ma'am," Carmen said firmly, "I don't know what kind of assessment you think you're conducting, but this is a hospital, not a public tour facility. We have patients who need care, and I can't have unauthorized individuals wandering around disrupting our operations." Sheinbaum remained calm, accustomed to skepticism from people who didn't recognize her outside of formal settings. "I completely understand your concern for patient welfare," she said. "That's exactly why I'm here. I've been receiving reports about staffing shortages and resource limitations. I wanted to see the situation firsthand." Carmen's eyebrows rose. "Reports? From whom? Are you a journalist? Because if you are, you need to go through proper channels. We've had enough trouble with reporters twisting stories about public health care." "I'm not a journalist," Sheinbaum assured her. "I'm here in an official capacity to evaluate how we can better support institutions like this one." "Official capacity?" Carmen repeated, her voice taking on a sharper edge. "What agency are you with? Where's your badge? Your authorization? Your escort from administration?" The conversation was beginning to attract attention from nearby staff and patients. A resident physician paused in his paperwork to observe the exchange, while two orderlies slowed their pace as they passed by. This kind of late-night confrontation wasn't unusual. Shia hospitals often dealt with confused family members, overzealous reporters, or well-meaning but misguided activists who thought they could waltz in and solve healthcare problems. "I appreciate your diligence in protecting the hospital," Sheinbaum said, maintaining her composed tone. "Security consciousness is important, but I assure you my presence here is legitimate, and my intentions are purely to help improve conditions for both staff and patients." Carmen wasn't buying it. In her 15 years of experience, she had developed finely tuned instincts about people trying to manipulate their way into places they didn't belong. This woman, despite her calm demeanor and articulate speech, simply didn't fit the profile of someone who belonged in a hospital at nearly midnight, claiming official business. "Listen," Carmen said, her patience wearing thin, "I don't care how official you claim to be. It's almost midnight, you have no proper identification, no appointment, no escort, and you're disrupting our workflow. I'm going to have to ask you to leave." The young resident who had been observing stepped closer, curiosity getting the better of him. "Is there a problem here?" "No problem," Carmen replied curtly. "Just explaining visiting hours to someone who seems confused about hospital policies." Sheinbaum turned to the resident with a slight smile. "Dr. Hernandez," he replied automatically. "Dr. Hernandez, how long have you been working here?" "About 8 months," he answered, then caught himself. "Wait, why am I answering your questions? Carmen's right. Who are you exactly?" The small crowd that had gathered was growing larger. 2 more nurses had joined them, along with a security guard who looked like he'd rather be anywhere else than dealing with whatever situation was developing near the reception desk. Carmen decided it was time to end this. "Ma'am, I'm going to ask you one more time to leave voluntarily. If you refuse, I'll have security escort you out. This is a medical facility, not a public meeting space." Carmen, one of the other nurses, whispered, "Maybe we should call Dr. Martinez before we do anything drastic." "Dr. Martinez is dealing with a cardiac emergency," Carmen replied without taking her eyes off Sheinbaum. "I'm not bothering him with this nonsense." Sheinbaum reached slowly into her purse, causing the security guard to tense slightly. "Would it help if I showed you some identification?" she asked. "That would be a start," Carmen said, though her tone suggested she expected fake credentials or some other deception. Sheinbaum withdrew a simple leather wallet and opened it to reveal her official identification card. She handed it to Carmen, who took it with the confident expression of someone prepared to debunk whatever amateur forgery she was about to examine. Carmen glanced at the ID card casually, then looked again more carefully. Her expression shifted from skepticism to confusion, then to something approaching alarm. She looked up at Sheinbaum, then back down at the card, then up again. This says," Carmen's voice trailed off as she struggled to process what she was seeing. Dr. Hernandez leaned in to look at the identification. His eyes widened. "Oh my God," he whispered. The other nurses crowded closer, each taking a turn to look at the ID card. A ripple of shock moved through the small group as the realization dawned. "President Sheinbaum," Carmen said weakly, her authoritative tone completely evaporated. "That's correct," Sheinbaum replied gently, taking back her identification. "And please don't feel bad about checking my credentials. You were doing exactly what you should do to protect your patients and your facility." Carmen's face had gone completely pale. "Oh no," she whispered. "Oh no, oh no, oh no. I told the president of Mexico to leave." The security guard looked like he wanted to disappear. Dr. Hernandez appeared to be questioning everything he thought he knew about his life choices. The small crowd that had gathered was now completely silent, everyone processing the fact that they had just witnessed their colleague attempt to eject the most powerful person in the country from their workplace. Carmen, Sheinbaum said softly, "You did nothing wrong. In fact, you did exactly what I hope every healthcare professional would do when faced with an unidentified person making unusual requests. You protected your patients and your institution. That's commendable." But Carmen was already spiraling into full panic mode. "I am so sorry, Madam President. I had no idea. I was just trying to. The patients, we have protocols, and you followed those protocols perfectly," Sheinbaum assured her. "I deliberately didn't announce myself because I wanted to see how the hospital operates under normal conditions. Your vigilance is exactly what I hoped to find." Dr. Hernandez, who was still processing the surreal nature of the situation, managed to find his voice. "Madam President, why are you here at this hour?" "Because this is when you see the truth," Sheinbaum replied. "Daytime visits with advance notice show you what administrators want you to see. Midnight visits show you what healthcare workers actually deal with every day." She turned to address the small group that had gathered. "I've been receiving concerning reports about staffing levels, equipment shortages, and resource allocation at public hospitals. Rather than rely on official reports, I wanted to see the reality for myself." Carmen was beginning to recover from her initial shock, though her hands were still trembling slightly. "The reports are accurate," she said quietly. "We're understaffed on every shift. Equipment breaks down and takes months to repair or replace. We make do with supplies that should have been updated years ago." "Show me," Sheinbaum said simply. For the next hour, Carmen found herself in the unprecedented position of giving the President of Mexico a guided tour of healthcare inadequacy. They walked through understaffed departments where nurses covered twice as many patients as recommended. They examined outdated equipment held together with improvised repairs. They saw supply closets that were perpetually understocked and treatment rooms that hadn't been properly maintained in years. At each stop, Sheinbaum asked detailed questions, took notes, and listened carefully to explanations of how staff worked around systemic problems. She didn't offer immediate solutions or make grand promises. She simply absorbed information with the focus of someone who understood that real problems required real solutions, not political theater. In the pediatric ward, they encountered a situation that brought the evening's purpose into sharp focus. A young mother sat beside her child's bed, clearly exhausted from what appeared to be days of worry. The little boy, perhaps 4 years old, was connected to a monitoring system that beeped erratically. "That machine has been acting up for weeks," Carmen explained quietly. "We've requested maintenance, but the repair company says the parts are discontinued. We're waiting for budget approval to replace it, but that could take months." Sheinbaum watched the mother's face, the constant anxiety of wondering whether the equipment monitoring her child's vital signs was reliable. "What's the workaround?" "Manual checks every 15 minutes instead of continuous monitoring," Carmen replied. "It's safe, but it requires more nursing time we don't have, and it's more stressful for families." They moved on, but Sheinbaum made a note about the monitoring equipment. This wasn't just about budgets and policies. It was about real people dealing with real consequences of systemic underfunding. In the emergency department, they observed Dr. Hernandez and his colleagues managing a steady stream of patients with resources that were clearly inadequate. A trauma case arrived just as they passed through Midas, a motorcycle accident victim who required immediate attention. Sheinbaum watched the medical team work with professional efficiency despite equipment limitations and space constraints. "How often do situations like this push your capabilities to the limit?" she asked Carmen quietly. "Every night," Carmen replied without hesitation. "We manage because we have to, but we're always one major emergency away from being overwhelmed." As they completed their impromptu tour, Sheinbaum found herself both impressed by the dedication of the staff and alarmed by the conditions they were forced to work under. These weren't lazy bureaucrats or incompetent professionals. These were skilled healthcare workers performing miracles with inadequate resources. "Carmen," Sheinbaum said as they returned to the main reception area, "I owe you an apology." Carmen looked confused. "Ma'am, you were absolutely right to question my presence here. You were protecting your patients and your workplace. I should have been more straightforward about who I was and why I was here." "No," Carmen protested. "I should have been more respectful. I should have done exactly what you did," Sheinbaum interrupted firmly. "You demonstrated professional integrity and institutional loyalty. Those are exactly the qualities we need in healthcare leadership." She paused, then continued, "Which is why I'd like to make you an offer." Carmen blinked in surprise. "An offer?" "We're forming a national committee to address healthcare infrastructure and staffing issues. I need someone who understands these problems from the ground level, someone who isn't afraid to speak truth to power, someone who puts patient welfare above personal comfort." Carmen stared at her, speechless. The position would involve traveling to hospitals across the country, documenting actual conditions, and helping develop practical solutions. "You'd work directly with my administration to ensure that policy changes address real problems rather than imaginary ones." "I don't know what to say," Carmen managed. "Say you'll consider it," Sheinbaum replied. "Healthcare workers like you shouldn't have to work miracles with insufficient resources. But change requires advocates who understand the challenges from personal experience." Dr. Hernandez, who had been listening to this exchange with growing amazement, stepped forward. "Madam President, if I may. Carmen is exactly the right person for something like that. She's been fighting for better conditions here longer than anyone." "Fighting how?" Sheinbaum asked. "Letters to administrators, reports to the health ministry, documentation of every equipment failure and staffing shortage," Dr. Hernandez explained. "Most of us complain among ourselves, but Carmen actually tries to fix things through official channels." Carmen looked embarrassed. "Nothing ever comes of it, because those reports disappear into bureaucratic black holes," Sheinbaum said. "Direct access to policymakers would be different." As word spread through the hospital that the president was on an unannounced visit, more staff began appearing in the reception area. But Scheinbaum's focus remained on Carmen and the handful of healthcare workers who had been part of the evening's unexpected encounter. "I know this is a lot to process," Sheinbaum said to Carmen. "You don't need to decide tonight, but I want you to know that what happened here, your willingness to protect this institution, even when it might have been inconvenient, is exactly the kind of leadership we need in healthcare reform." Carmen nodded slowly, still processing the surreal turn her evening had taken. "Can I ask you something, Madam President?" "Of course. Why didn't you just announce yourself when you arrived? It would have been so much easier." Scheinbaum smiled. "Because easy visits show you what people want you to see. Difficult visits show you what they actually live with. Your reaction tonight told me more about the state of this hospital than any prepared presentation could have." She looked around at the group that had gathered. "You all care deeply about your work and your patients. That's obvious, but you're being asked to do too much with too little. That's not a failure of dedication. It's a failure of resource allocation, and that's something we can fix." As Scheinbaum prepared to leave, Carmen found her voice again. "Madam President, about that committee position, yes. I'm interested. When do we start?" Scheinbaum smiled. "How about tomorrow? We have a lot of hospitals to visit." The story of the nurse who tried to kick out the president spread through the hospital within hours and through social media by morning. But rather than becoming a tale of embarrassment, it became something else entirely. A story about healthcare workers who were so dedicated to protecting their patients that they were willing to challenge anyone who might disrupt care, even if that person turned out to be the president of Mexico. Carmen became the face of a new healthcare initiative that prioritized ground-level experience over administrative theory. The monitoring equipment in the pediatric ward was replaced within a week. The understaffing issues began to be addressed through emergency budget reallocations. And in hospitals across Mexico, healthcare workers found themselves with a new advocate. The midnight visit that began with a confrontation became the foundation for healthcare reforms that actually addressed real problems because they were developed by people who understood those problems from personal experience. Sometimes the best way to create change is to listen to the people brave enough to protect what matters, even when it's inconvenient.